Welcome, everyone. Again, my name is Ladon Sapani, and I'm the Program Manager for Green for All's Communities of Practice program. I am joined by my colleagues Satya Rhodes Conway and James Irwin at COWS and the Efficiency Cities Network. And I want to welcome all of you again to this first joint call of the Efficiency Cities Network and Green for All. Both of our organizations are committed to creating peer networking and learning opportunities for people like you who are working to retrofit our nation's building stock and to create good green jobs in the process. So one of the ways we do that is through national learning calls like this one. And the Efficiency Cities Network has been holding these calls every other Tuesday at this same time. And while we have been collaborating as organizations from the beginning, we're excited to be holding today's call jointly. And I'm particularly excited about the topic of our call today, which is focused on how to adopt an integrated approach to retrofitting so that we are leaving homes not just more energy efficient, but also healthier for the people who live and work in them. Our presenters today are actually going to talk from both a national policy perspective and from an advocacy perspective to give you some background on what Healthy Homes is all about and why this is so important. And then we'll also hear from our presenters on how this integrated approach can be implemented on a local level. I'm going to go ahead and introduce all of our presenters for the call, and then we'll dive right in. First, we'll hear from Ruth Ann Norton, who is the Executive Director of the Coalition to End Childhood Lead Poisoning and is Chief for the Coalition's Green and Healthy Homes Initiative. Ruth Ann is a noted expert on incorporating environmental health standards in housing-related programs and serves as an advisor to government agencies, nonprofit organizations, and foundations. Ruth Ann has been credited by the Governor of Maryland as the architect of its 96% reduction in childhood lead poisoning and serves on the expert panel developing HUD's upcoming Healthy Homes Guidance Manual. Welcome, Ruth Ann.
Thank you. Glad to be here.
Next, we'll hear from Alice Kennedy, who is the program coordinator for the Baltimore Neighborhood Energy Challenge, also known as BNEC, which is one of the partners of the Green and Healthy Homes Initiative in Baltimore and uses a community-based outreach approach to generate demand for energy retrofitting. Alice's background includes community organizing, project management, green building, and green real estate. And then last but not least, we'll hear from Dan Curry, who is the Manager of Community Sustainability at the City of Greensboro in North Carolina, where he's responsible for implementing the city's $5 million award from the U.S. Department of Energy for what they're calling the Energy Efficiency as a Pathway to Community Health and Wealth project. This program is going to use a neighborhood-based approach to generate demand and is also integrating healthy home strategies into their program to address the high asthma rates in the targeted neighborhoods. Dan previously served as acting director of the city's Housing and Community Development Department. Welcome, Dan.
Thank you very much. Glad to be here.
And then for those who haven't heard, the Department of Energy has changed the name Retrofit Ramp Up to Better Buildings. So congratulations, Dan, on Greensboro's $5 million Better Buildings Award from DOE.
We're excited and challenged, to say the least.
Great. Well, again, as a reminder, we're going to go ahead and hear all the presenters first and then go to Q&A for the second half of the call. But if you want to submit your questions during the presentations, you can send them to question@greenforall.org, or you can raise your hand by pressing 5*. So without any further delay, we're going to go ahead and get started with our call. So Ruth Ann, if you can go ahead and get us started.
Sure, and I just want to say thank you again to the Efficiency Network and Green for All for having us. And I think we will talk about sort of a national view of how we are trying to move the framework of integrating green and healthy interventions together. And I think it'll be a nice wrap-up to hear from Greensboro about the on-the-ground work. And I'll talk a little bit about the on-the-ground work that we are doing in Baltimore that frames this out as well. So thank you very much. I thought I would just start out by kind of telling you a little bit about this 14 initial project sites that we're doing under the National Green and Healthy Homes Initiative. And it's an initiative that is funded by members of the Council on Foundations, as well as HUD and CDC, and supported by the White House Office of Recovery implementation, among others. So we have designated to start work to get 12 cities and 2 tribal sites. There's a map that you'll see in the slides. And in that work, we are looking to create a set of standards, practices, and principles that cities and non-government organizations, nonprofits can follow in order to do a comprehensive look at a house to incorporate health-based standards in all of its interventions, not just its energy interventions, but using energy efficiency and weatherization as sort of the pivot point that allowed us to do this ramp up, if you will, but also to create the tools that will allow cities to really identify current resources, remanage those resources and repurpose them, and find ways to, by integrating the health frame, to attract both new resources and better use the ones they have. The investment in energy efficiency allows us to be able to touch more houses, and to hopefully, by doing the integration of green and health that I think you'll see in the presentation today, we actually make weatherization money more efficient. In many of the cities in which the Green and Healthy Homes Initiative is working, we get reports of weatherization assistance programs, for example, that 30, 40, 50, and in some instances 60% of the time do audits that do not move forward from an energy audit standpoint because of health and safety issues, roofing issues. And part of what Green and Healthy Homes is putting boots on the ground in these cities is to help make that money work, to move it forward, and to answer the puzzling question of how do you address the health and safety issues in a way that allows the weatherization assistance and the energy efficiency programs that are on fast track to continue to move at real-time speed and put money where it can with the greatest outcomes. So, again, if you go to the second slide here, the Green and Healthy Homes Initiative will create for these cities, and then sharing this with the Federal Interagency Work Group on Healthy Housing that has been tasked to help design a new national green healthy home standard in the United States. We will help to create standards, principles, and tools for each of these sites that include a comprehensive health and housing assessment tool. That is effectively to have multiple agencies within a jurisdiction being able to use a common assessment form that looks at a house both for health and housing issues and is able to utilize one pathway into a house, but to populate that information into various agencies and programs that need to share that information, so that if I am the code enforcement inspector or I'm going in on behalf of a asthma-related intervention program or a weatherization assistance program, that auditor and that inspection team can, at the time of first touch to that house, do a comprehensive assessment both for health and housing, and then be able to share that data across the various networks. Then to help cities look within their own assets and their own structures to create a framework for how you integrate that work, not just in one neighborhood, not just in one project, but as a practice across the entire city government or across the region, so that we're effectively taking that house on a one-time basis and able to address all of the items in the scope that address green, healthy, and sustainable housing. GHHI was also formulated as an idea and a practice and as a design out of the work that was being done by nonprofit organizations such as the Coalition and through the voice of the Council on Foundations. So as it was taken to the White House and taken to the federal agencies and the interagency work group, philanthropy is an investor and a partner in the Green and Healthy Homes Initiative. And in fact, in each of the sites that were chosen as the initial project sites, there are and will be at least 2 philanthropic entities that will be investing in the work to try to create the demonstration of public and private investments for the triple net benefit. The triple net benefit for the work that is being created for Green and Healthy is the creation of green and healthy housing units in low-income neighborhoods to stabilize those houses, to create a higher pathway to green jobs, to take a property maintenance worker or a lead hazard control worker or a weatherization assistance worker, for example, and instead of having them be single-skilled, to train them in the entire pathway of those skills to create a green and healthy homes worker so that worker can complete the health and safety work and the weatherization work in the same job effectively, and to be able to move beyond the stimulus or move beyond just working in grant work coming out of a community, but to be able to work in low and moderate income housing and sustain their work over time. Our initial data is showing taking workers from a $9 an hour wage up to a $20 and $22 an hour wage when they have the full complement of skills. And clearly, and this is where the philanthropic interest and philanthropic investment came in this, is to create measurable and to demonstrate the measurable outcomes and improvement in child health, but also in senior health, because in the work of green and healthy housing, it is to incorporate the reduction of asthma, the reduction of lead poisoning, and also unintentional injuries. So making sure that the safety factor is in there, and that injury prevention work is highly beneficial both to children and to seniors. So then, the case for this is really very clear. We have about 250,000 children in the United States who have diagnosis of lead poisoning. There's probably more children, obviously, because we test such a low percentage of children living in housing that has lead hazards and kids in homes. That's about 6 million houses that we know of. There are about 24 million housing units that have known lead hazards. There are about 800,000 asthma-related ER visits every year. The Robert Wood Johnson Commission on Building a Healthier America points to the fact that about 40% of those cases, at least, are coming from environmental health hazards in the home that are preventable. There's about 20,000 carbon monoxide poisonings, and about 13 million people who suffer home-related injuries that are entirely preventable. And clearly, as we all know, this leads to things like wealth depletion and abandoned properties, housing instability, homelessness, and housing-based illnesses. Green and Healthy looks to address those and looks to recapture savings back by incorporating both the reduction in energy consumption and the reduction of these preventable injuries and illnesses. As I said earlier, this came out of the work that we did with the Obama transition team, where they were looking at the weatherization and energy efficiency investments, and we were looking to find the pathway to properly address the health issues and move in this. And so this allowed us to really use that as a pivot point to advance the work of healthy housing. The initial agencies that have been engaged in this work and the funding pathways engaged in this work in the 14 sites are listed on this slide in front of us, which include weatherization assistance and energy assistance programs. Clearly, the Healthy Homes programs out of the Office of Lead Hazard Control, But also to move this framework and move the health standards into neighborhood stabilization, choice neighborhoods, and to utilize funds from programs such as the Maternal Child Health Block Grant Title V funds that can be used for injury prevention. There's a longer list of federal programs that can be used, and the point about green and healthy is to infuse these standards, this new standard for green and healthy housing, across the federal framework. Any dollar invested in housing intervention will have a health-based standard, and so this is to help inform that. The partners in the project, as I noted earlier, include the White House Office of Recovery, the Council on Environmental Quality, Council on Foundations, our organization at the Coalition, HUD, who houses the Office of Healthy Homes and Lead Hazard Control, but also the CDC, DOE, and EPA. Lead philanthropic agencies include the NEKC and the Kresge Foundation, but we have support from 28 local and national foundations to work in the project sites to ensure that all programs will incorporate health-based standards in the energy efficiency work. And we are beginning a new partnership with the U.S. Conference of Mayors to ensure that every mayor's office who belongs to the conference is trained and educated on how to incorporate an integrated housing and health program, which is happening in the cities around the country. The 14 cities are on the map. 14 locations are on the map. There are 12 cities and 2 Indian tribes. There are 10 cities that are already being teed up as next generation green and healthy home sites. And the next gen cities include Minneapolis, New York, St. Louis, Omaha, Houston, Seattle, and others that will be a part of the first 2 years of demonstration on this work. But these initial cities are tasked to implement the comprehensive assessment form, the single intake process, to help inform the federal work group, Healthy Homes Work Group, on barriers that are faced in trying to do the integrative work that's happening in Baltimore and that you'll hear about in more detail in Greensboro and others, but to help use these cities as an informative basis to the Federal Healthy Homes Work Group on the barriers and those best practice resolutions that the cities come up with in a peer learning network. They will also be charged with trying to not only implement standards, practices, and principles in each of their agencies, but in doing a minimum of 250 units that will be used for data and information about integration in helping us to better frame the new housing standard, but also federal NOFAs and RFPs and work that's going to be done in the various agencies. So the guiding principles of GHHI are clearly to break the link between unhealthy housing and sick children in any form that we're doing housing intervention. Its main product is in helping to replace the standalone programs at local government and to begin an integrated practice, particularly in weatherization, lead hazard control, and then various home repair, roofing programs like LIHEAP and others, and then general safety programs. It is to also look at the feasibility of the integrated strategy in low and moderate income communities, and it will track the reduction of inefficiencies under the current system by either reducing the number of programs or the number of contractors, not to reduce work, but it will effectively help to increase work, but it reduces the time and the number of times a housing unit and a family has to go through a system and try to address the problem, as we said, in a one-touch basis, and to complete those multiple interventions in a single home intervention process. Clearly, the reduction of barriers to intergovernmental coordination is key, not only in terms of eligibility criteria between different grant programs, but in just workplace barriers. And to help to do something that DOE has taken on clearly and has been starting to really strongly lead, which is the reduction of unsafe work practices and weatherization and energy efficiency interventions to generate lead hazards, asthma, and other aspects of that work. So the basis here is to the strategy in which this is built is sort of an align, blend, and coordinate strategy. It is to under the alignment is the agreement on housing intervention standards, both at HUD and at the federal work group, utilizing things such as the Center for Disease Control has worked with organizations like the Coalition and many others to come up with a what works in terms of health-based housing interventions and to integrate those into standards, to pinpoint opportunities for integrated programs and funding at the federal and local levels, to work with the agencies to adjust the notice of funds availability, grant programs, loan programs, and financing mechanisms, to include health-based standards, to remove the known and discovered barriers as we do this work over the next 2 years with these cities, and to create a common data and reporting format is one of the longer-term goals. But if you are a housing agency that has been, who wants to move the frame forward and incorporate health and safety into your work, along with energy efficiency, that we can create a common reporting form for all federally funded housing intervention programs, reducing the amount of time you have to spend on reporting and more time in the field and into programs. Clearly, the guidepost here is to work horizontally and to make sure that we can work across agencies and work from local to federal and not have the barrier or long-term bureaucracy in making change. At the blending side of this is to leverage federal programs and to show in practice and to demonstrate on a daily basis how you can blend federal funding and philanthropic resources for that gap funding or base capacity building, to create compacts to justify and target state and local funds. These compacts that we're working on look at the savings, the health-based savings and the energy savings that are generated, putting those back to present value and being able to shift state and local budgets to put more money into prevention. It will also be utilized as a new framework to enhance the discussion that is being had with the Center for Medicaid Services, medical assistance, in having those public assistance agencies on the health side fund primary prevention and housing intervention rather than the back-end cost, for example, of a child going to the emergency room for asthma. It will support social enterprise networks for nonprofit organizations and try to get PRI and other funding to move those enterprises forward. At its core, it will provide technical assistance for remanagement and repurposing by doing a thorough asset mapping and examination at the local site to move the integrated process forward, and to work with each site to capture new lines of funding. We talked about the Medicaid, but also hospital community benefit funds and corporate philanthropy, and creating a general Green and Healthy Homes Fund over time that cities can draw on to augment other federal funding. On the coordinate side, we will be doing asset mapping and helping to provide cities with tools that can help them more quickly align and blend the funds, to identify gaps in each city that may be necessary to move this forward. One of the things that we clearly are moving forward in the 14 sites is to quickly get on the ground a project coordinator who can push the frame of integration over the next 2 to 5 years. But also, if you try to blend your weatherization and your Healthy Homes program or your home repair program in identifying any gaps that exist, and either filling those with philanthropic funds or by redirecting resources. We will help cities create a single portal and the shared data platform, a single portal for intake and assessment. Every city will have a learning network hosted by a local philanthropy where the key players in the integration frame, both on the government and non-government network, as well as workforce development, will come and share best practices, can use that as a triage system to address troubled neighborhoods, troubled housing, and to work together on capacity and resource building for the network. There will be a strong education component to make sure that that education is, and the concept and practices of Green and Healthy are available to the entire community, as well as establishing real integrated training that has health integrated into the practices, the green training practices for energy efficiency and weatherization, not as a separate module, and to work for a certification that encompasses green and healthy together. And each site will track the efficiencies that are created, the reduction of time and cost per unit, but also the projected medical savings that are there. And I'm sorry, the slides, I think we have a set of draft slides that are up here, so if you're looking at them, I will tell Ladon that we will post the slides that are a little more complete, because some of this is less complete. I'm going to very quickly take you through one example in Baltimore of what we are finding in the Green and Healthy Homes work, and try to give you some real example of what we're seeing on the ground. The first thing that we have learned in the first 200 houses in the Baltimore Green and Healthy Homes initiative site is that we have identified clear efficiencies and cost savings by coupling weatherization and energy efficiency programs with the Healthy Homes and lead hazard reduction in terms of time in the unit and hard cost. Clearly, we're able to take units that would otherwise not get weatherization funding because of health and safety issues and turn them into units that will get the benefit and the long-term benefit of energy efficiency investments. In the first 60 units, the calculation and the dollars which we can lay out for people, we saw an average savings of around 23 to 27%, a little bit more than 25% on average for those houses, which means that in time and materials, we had a reduction, but in actual hard cost of taking an integrated practice of weatherization, Healthy Homes, and things such as venting and integrated pest management, moisture control, reduction of mold, reduction of lead. When we did this as an integrated practice with contractors trained to address the unit as a whole rather than as its parts, we had an average savings of 25% in terms of dollars as well. So we had an average cost of $12,057 per unit. Individual programs not addressing the fact that a family is likely not to get into the 3, 4, or 5 programs and do that in a fairly efficient time frame. At its core would cost about $16,000. We saved about $4,000 a house while not increasing time over a general in large form or fashion, I think we had about an extra day to an extra 2 days of work on average. We were able to move this, using this green and healthy practice, to move the Baltimore City off the Weatherization Assistance Program to start incorporating health and safety practices, starting to look at integrated pest management, a major issue to address before weatherization, as well as redirecting other health-based issues for asthma. And so we've been able to do that, and we've also found increased skills and expanded opportunities and wage increases for workers who were trained. If you look at this, for example, if you take the ER visits, and I'll talk to you in a second about a case study, but for every emergency room visit that a child has because of asthma is $2,500. We have case after case after case where we have kids going 8, 10, and 22 times, one of our families, where their child went 22 times in 6 months to the emergency room. Clearly addressing the health and safety issues at the time we're doing the weatherization more than pays for the intervention. And it has helped us to expand the funding sources on a system-wide basis. So let's just take a look quickly at one unit, which may be that we used that came in, and this is Lake Avenue in Baltimore. I know LaDon and some others on the call may have been at a site visit at this unit, and this is the Young family. Mrs. Young is employed by the Baltimore City Police Department as an administrative assistant. Her son Dwayne, who's probably 9 now, but was 8 when we did this unit, had multiple and repeated visits to the emergency room for asthma. The family did not have a working water heater or furnace, and Mrs. Young herself was on the cusp of losing her job at the police department. Even though she was a good worker, she was missing too much time, and the health and safety issues of her home and the energy efficiency or lack thereof issues, which were causing multiple problems, were also causing her to miss work. She came in with an asthma-diagnosed child, referred by the healthcare provider to our Healthy Homes demonstration program. We did a comprehensive health and housing assessment and worked with our Green and Healthy Homes Initiative network. In the unit, we were able to perform in one intervention time period lead hazard reduction, Healthy Homes addressing mold, moisture, and pest management issues, weatherization, and then energy efficiency, including adding Energy Star appliances. And we wrapped this around with education through the Baltimore Neighborhood Energy Challenge, which Alice will talk about in a minute, as well as behavioral health education and post-remediation maintenance education. We, in that $12,000, we saved well over 25%, but I think the upside of that case is that we were able to use multiple funding in one time, and in the past year, Dwayne has not only not returned to the emergency room, but is now on the honors list, and Mrs. Young has been advanced and promoted in her work. So they were able also for the first time in 5 years to actually have a working heater, heat system, and furnace system. By adding a cool roof and Energy Star appliances and weatherization, they've had, I believe, close to a 30% reduction in energy use in that home. So moving forward, Green and Healthy sites will be receiving local and technical assistance. The standards, practices, and principles will soon be signed by each of the sites so that they have a compact on how they will operate. They will help to implement a comprehensive assessment forum. They will be providing key data, which will be shared to the Federal Healthy Homes Work Group. And each site will be part of a national learning network to work with both federal agencies and nonprofits and community developers on how to do best practices, and that includes working with other strong national partners. Every site will have a communication network to share the findings, and that will be shared publicly through a public-facing communication site. So you, whether you're in or not in a Creating Healthy Homes Initiative site, you will be able to see the work that's being done, the case studies, the best practices, as well as the discussion on barriers and being faced and recommendations being used to resolve those barriers. We will be working with the Federal Healthy Homes Work Group on the healthy housing standards, and then we are looking at criteria on how, both through our federal and private sector partners, to add sites moving forward. This is just a quote from Sean Donovan about HUD's intent and commitment to incorporating green and healthy home standards, not only in the HUD programs but across the federal framework. And he made that commitment in October of 2009, and coming in September or October of this year, we collectively are due to report back on progress being made by various programs on moving that forward. So I'm happy to take questions. I know I kind of ran through this, and again, LaDon will place the more complete slides. I know we kind of put these up here quickly.
Great. Thank you so much.
We'll talk about this.
Great. We'll take questions at the end. If people can, go ahead and email them to question@greenforall.org now. And we want to make sure we get enough time for questions, so we'll try and move through the next slides a little bit more quickly. And I wanted to ask the next speakers to maybe let people know what slide you're on as well. So Alice Kennedy from Baltimore Neighborhood Energy Challenge, if you could go next.
Great. Thanks, LaDon, and thanks for having us on the call. So the Baltimore Neighborhood Energy Challenge is a program that's out of a partnership between the Baltimore Community Foundation and the Baltimore Office of Sustainability. So our program actually is a very good example of a public and private partnership working together and then pulling in other partners from across the city as well. The Coalition to End Childhood Lead Poisoning has been one of our partners in terms of both the GHHI initiative and getting involved with that, and then also lead reduction in the homes as well while we're out in the neighborhoods doing our work. We just completed our 9-month pilot period, and our efforts during that period were concentrated in 8 Baltimore neighborhoods. Baltimore is a unique city. We have actually over 225 neighborhoods within the city limits, so we had to choose 8 of those to focus on, and we chose them for a variety of different reasons in terms of diversity of housing stock and demographics as well. The program, as you can see, is designed to raise awareness, reduce residential energy use, stimulate demand for the energy conservation services, and learn lessons on how to motivate behavior change related to reducing residential energy use. And really, the kind of core idea and belief for the program was born kind of out of the understanding that there are 2 different, there are 2 keys to residential energy conservation, and one of those is actually the efficiency of the components of the built environment. So that would include the building envelope, the systems, including appliances, heating, cooling, HVAC. But then it also, one of the other large keys to that is the behavior of the home's occupants. And that key is what we are focusing on through our program directly, but then forging these partnerships with different organizations in Baltimore, including the Weatherization Office and other nonprofits that are doing nonprofits and for-profits that are doing work to kind of work on the efficiency of the components in the built environment, and then we can focus on the behavior of the home's occupants. Going on to the next slide, basically what we were looking at in terms of how to make this work, we actually just launched our program last August of '09, and we were looking to challenge the 8 neighborhoods and their residents to reduce the energy use from their own baseline. So we weren't trying to have the neighborhoods necessarily compete against each other. It was more, what can you do in your home and how can you challenge yourself as an individual and a family within your home to make changes. And we looked at those changes that we were really looking at trying to get people to do in terms of this idea of a ladder, and that the first rung of the ladder that people can step onto are the very easy, no-cost, very basic behavior changes that can happen in the home, which is making sure that they're turning off the lights, turning down the thermostat on the water heater, utilizing changing the temperature and settings of the thermostat and so forth. And then the next rung of that ladder would be other things that combine both behavior change with some small investments. So that would be power strips or low-flow shower heads, making small kind of installation changes here and there. And then as you move up the next rungs of the ladder, then you get into larger cost interventions that can happen in the home, including energy audits, air sealing, insulation work, windows, doors, and then also incorporating in that, one of the things that we've done from the beginning is when people are looking at doing those interventions, making sure that they do pay attention to and incorporate healthy home standards, so looking at pest reduction and asthma reductions and indoor air quality as they make those changes to the home from the energy efficiency standpoint. So since we were kind of looking at that from the beginning, that made a very good relationship for us in terms of moving and over to becoming a partner with GHHI in terms of behavior education here in Baltimore. We created a web-based interface for participants and the public to use, and that web also served as a central hub for our data collection. What makes us unique from some of the other kind of energy challenge programs across the country is that we have a relationship with BG&E, which is our local utility, and we actually are able to collect actual usage information for our participants from the utility. And we've been able to track their usage and compare that from '09 to 10 in terms of the winter months, and we've compared that to their usage from '08 to '09, and that's how we'll see some reductions that have occurred with our program through the ability to have that data collection there. We utilized AmeriCorps service members for the program, went out into the neighborhoods and recruited energy captains that we did some training with, and then would do door-to-door outreach, neighbor to neighbor. So it's the idea that a neighbor talking to a neighbor about energy conservation, about what they've already done in the home, that those are the areas where people will pay more attention to if it's somebody that they trust that's within their community versus somebody coming in from the outside, just to try to tell them that these are things that they should be doing, or even having it come from the utility in terms of what they could be doing. It kind of puts up a barrier, and so the idea is that that neighbor-to-neighbor outreach would break down that barrier. And an example of this, actually, Ruth Ann spoke earlier about Mrs. Young on Lake Avenue, and there was actually another GHHI home and resident on Lake Avenue as well, Mrs. Clay. And Mrs. Clay actually acted as a neighborhood energy captain for us for their block. And through her ability to kind of talk about not only the interventions that happened on her home with GHHI, also what Ms. Young received, and then the energy savings and cost savings that they saw, that they were actually to go out and with our AmeriCorps members and staff, we did door-to-door canvassing on their block, and we had 90% of the homes on their block signed up to participate in the Energy Challenge program and received our Energy Savers Kit. and additional information from us throughout the course of the pilot. And then Mrs. Clay and Mrs. Young have subsequently continued to talk about energy conservation and the savings and the additional programs that they received, and then also what else is available. And we've had other phone calls and referrals from people on the block in terms of receiving more information or getting weatherization assistance and kind of moving forward. So that's kind of the role of the captains and how they work. We asked the participating households to sign a public pledge, and that public pledge says that they'll adopt no and low-cost behaviors within the home, and that they'll pay attention to their energy usage, and they'll share what they've learned with their neighbors and friends and encourage participation in the program, and which will both strengthen both the sustainability of their community and the health of their community. And they also agreed to complete a pre-enrollment and post-enrollment survey. And on the next slide, you'll see the first page of that enrollment form and the survey. So we have the public pledge, their name, contact information. We gathered their BGE account number through this process. And then the enrollment survey was basically utilized to gauge their baseline knowledge and baseline behaviors as to what they were already doing in the home. And one of the other great things that we did with the program is we utilized window and yard signs and put those up at all of the participating households, so that if you were participating in the program, there was a yard sign in your front yard, and that also would get people involved and ask, well, what's going on with the Baltimore Neighborhood Energy Challenge? How can I get involved in that? And then that sparks that neighbor-to-neighbor conversation to happen, where not only do they talk about joining the program, but they also can share little tidbits of information at that same time. So we selected the neighborhoods, like I said before, and based on diversity of geography, housing type, race, income levels, and also the level of community organization. Also, we looked for neighborhoods that were already participating or working on some other green activities, whether or not it be around recycling within the community or community gardens, water conservation activities, anything else that they've had contact, or also green schools programs, to see where we could make and kind of leverage what they've already been doing into another program and kind of continue to ride the momentum of what they've already established as activities that they find important. And then also looking to see the target neighborhoods in terms of what other involvement they've had with nonprofit and also government agencies and organizations within the program and within the city, and what their partnerships have already been and how we can leverage those partnerships that already exist in those neighborhoods.
Alice, this is Ladon. I'm just, I apologize to rush you, but I'm wondering if we can move through the slides a little bit faster so we can make sure we get to Dan.
No problem.
Thank you.
So what we looked at in terms of, I'll actually skip through a couple slides to number 29. We went through, we were able to give each neighborhood a $1,000 stipend that they could utilize to encourage participation and work. And we also had the AmeriCorps members that worked with them through the entire year of the pilot program to work hands-on with them and kind of get things together. Through the activities in the pilot program, we trained over 129 energy captains. We canvassed throughout the city on 2 very large canvassing days in terms of 700 households. And you can see that there's other information there. But one of the, I think, in terms of activities and things that came out of what we've accomplished during the pilot is actually the relationships that we've been able to forge with the other nonprofit organizations, government agencies, schools, and also communities of faith that are within these communities. And that's actually kind of specific to what we've been able to forge with GHHI. And when we're out in the communities, what we actually look to do when we're out doing these canvassing events or meetings and fairs, tabling at farmers markets, et cetera, is we look to see who is coming to the booth, asking us questions, looking at specific things in our conversations with them, or while we're canvassing, are we able to notice that there are lead paint hazards at the home? Do they talk about the fact that their child has an asthma or health-related issue? And then we're able to act as a referral base to the GHHI program, or also to the weatherization program here in Baltimore. And then they're able to go in and do the actual intervention in terms of the built environment, or the efficiency, the cool roofs, the furnaces, et cetera, and talk about, they also follow up with the behavior change in terms of relating to the health and safety hazards in the home, and then how to live in the home after those interventions have occurred. And we're able to then complete the circle by also continuing with our education and community outreach, so that more people understand and get information about conservation techniques in the home. But then we also are finishing up with the kind of what our second key is to the residential energy conservation, which is continuing to educate and work on the behavior of the home's occupants from an energy standpoint. If you slide through to slide number 35, or page 35 of the PDF, we were able, through our pilot program, we had reductions as high as 12.8% for electricity reductions within the Park Heights neighborhood, which is a lower income African American community in Baltimore. And so the program, just based off of our network of partners, neighbor-to-neighbor conversations occurring, education, and outreach, we have been able to see these reductions occurring from electricity. The other big thing was that we have 74% of our participants have reported back on their post-survey, and this is slide 37, of speaking to others about energy use and energy conservation within their community. So when we're talking about a program that is basic, Crutch is talking about neighbor-to-neighbor conversation, building that network of information within the communities, and looking at behavior change and how to make that happen. The fact that we have 74% of our participants speaking with others about that, that's a number that we're very happy with, and think that it goes to show that the program works and that those relationships do work. And I know that in terms of follow-up with Mrs. Clay and Mrs. Young from the GHHI sites on Lake Avenue, they have continued to talk about energy conservation, about the challenge, about the interventions that happen with GHHI on their home, with their neighbors and their friends. And I know that we'll be going back to that site this year and continue that relationship. So we're adding 12 new neighborhoods to our expansion. We're continuing to forge and strengthen our relationships with the Weatherization Office and GHHI and the Coalition to End Childhood Lead Poisoning, the Health Department, and other social service and social enterprise organizations within Baltimore to continue our outreach and education efforts.
Great. Thank you so much, Alice.
You're welcome.
And there are some great questions that have come in. We're going to go ahead and hear from Dan Curry at the City of Greensboro about their energy efficiency as a pathway to community health and wealth project.
Okay, thank you very much. And let me first start by thanking the Efficiency in Cities Network and Green for All for giving us an opportunity to be on this call. We're learning a lot as I sit here. We're a community that is just now beginning the program development for our retrofit ramp up, or as we now need to call it, Better Buildings grant from the Department of Energy. That was we were one of 25 communities that were awarded funds in this last round of funding. We have a $5 million grant that we are going to leverage into a $30 million Better Buildings program focused on health and wealth building in our community. And that was a very deliberate kind of titling of our effort. It came in a very good time for us. We were just finishing up our data analysis for our 5-year consolidated plan for housing and community development activities, and we're quite startled by some of the results of what has happened in our community, and I'm sure other communities have experienced this as well. that not just because of the most recent recession, but over the last 10 years or so, we've seen quite an increase in the level of poverty in the number of persons who are at stress in our community. And so we began looking at how we are going to address our affordable housing issues, and basically have concluded that you can't build your way out of this issue, and so we have to come up with new tools and strategies, and energy efficiency is, without a doubt, one of the primary ways that we believe we can address our affordable housing and wealth building challenges. We're building this program off of a lot of work that's been underway by a lot of different organizations here in Greensboro, and I'm going to just flip through a couple of slides because I know we're running a little short on time and want to get to some questions. So I'm going to go straight to slide 43. We've had an aggressive housing rehabilitation and lead grant program here in Greensboro for a number of years, and we also have a very strong program building in the Healthy Homes arena with our Greensboro Housing Coalition taking the lead in that. And so we've built our program for this grant around a targeted area in East Greensboro. It is roughly 40 neighborhoods, and I'll show you a map in just a minute. But within that area, our basic goals for the program are to reach out and touch every property in this area, and that's about 17,000 properties in total. And much like Ruth Ann and Alice have described, we're doing this through a neighborhood delivery system where we're working very strongly with our neighborhood Congress and about these 40 neighborhood associations to train and build the capacity that they have to do this work in their own neighborhoods. At the same time, we want to build the capacity and the quality of our local contractor pool, again, by pulling folks out of these neighborhoods that are at a position where they're looking for opportunities to build their skills and abilities. And so we're focusing on workforce training delivered directly into the neighborhood areas. And I'll move to the next slide. Slide 44 gives you an idea of where we're focusing this effort. We built it around our recovery zone, which we had previously designated for some of the earlier stimulus money coming into Greensboro. And so if you see phase 1 and phase 2 on this map, those are the areas that were designated as recovery zones in Greensboro. And when we began to look at the funding available through this program, we've decided to focus in on phase 1, which is about 13 census tracts in East Greensboro. On the next slide, it gives you a little bit of information about this focus area. Again, we've got roughly 17,000 housing units, over 1,000 businesses and institutional uses. It's an older area, mostly low and moderate income. We have several things that we think are primary assets for this effort. Most notably, we have North Carolina A&T State University and Bennett College, as well as several other school and institutional developments. And we're going to be targeting our institutions in the early stages of this as we gear up our residential program, because we think we have some existing opportunities to work with some of our major institutions as well as our faith community to build the efficiency of their institutional buildings, and also kind of using that as part of our educational system that then will communicate back down to residents and property owners. On slide 46, gives us kind of lays out a few of our key strategies. Again, I'm kind of duplicating what's already been stated, but working with the existing market system, and I do want to say the Department of Energy has been phenomenal in providing technical assistance for this program through their Clean Energy Roadshow and their technical assistance teams. It's just nice to know that there's so much available information and available assistance through those organizations, through the Green for All. We're not in this alone, and that's a really good feeling, particularly for communities that are beginning their programs as we are. And one of the things the Department of Energy has indicated they are working on is standardizing assessment systems, standardizing how we're labeling our products, such as Energy Star or whatever the labeling might be, and using that as part of the way that you market this and build it into the market dynamics in the community. I've already said we're focusing on a neighborhood-based approach. So we, again, as you've just heard, training community organizers, bringing them out of the neighborhoods and having a training program and then having them be the first point of contact. We think it's very important that we have familiar faces, and because the biggest challenge that we believe we have is just getting our foot in the door. And neighborhood residents are probably in the best position to be doing that initial contact. We also have selected an area where we already have a tremendous amount of partner involvement in our existing housing programs, our lead programs, our healthy homes programs. These are neighborhoods that we're familiar with, that we already have tremendous relationships with, and I think that's going to be real important in getting out and delivering and hitting the numbers that we have to deliver. Giving you on slide 47 just a partial list of some of the participants in putting this application and the program together. We're not yet calling these partners because we'll be going through a request for proposal process to actually put pen into who we're going to be working with in the specific elements of the program. I'll highlight the Housing Coalition, particularly their work with our local healthy homes efforts. They've developed intervention models and integrated pest management protocols that are going to be very heavily a part of our delivery system here in Greensboro. We've worked closely with A&T State University as well, who will be undoubtedly working with us on doing a lot of the monitoring and verification work. As you've heard with other programs, we will be getting commitments from each property owner to provide their energy and utility billings so that can be tracked, because measurement and verification obviously is going to be a key component of this effort. You can see some of the other partners that we have involved in this effort. We have a faith community focus, again, because we believe that's going to be a primary way that we're able to get the word out and really market the program out into the community. Finally, on 48, we've got some of the challenges that we see as we work through program development. Building a better building menu, and this is something that the Department of Energy is working very strongly on, the standardized audit methodologies, specifications for the actual energy efficiency retrofit work, and we think that's going to be very, very important in terms of making sure that what we deliver is high quality work, and that we're growing the workforce and contractor base that can do this work long after the grant funds have been expended. On the financing end, we have planned to use PACE financing. Obviously, that's up in the air at this point because we're going to be focusing a lot on institutional buildings. We do still believe that we may be able to put a PACE program in place for institutional commercial properties that may not have the same issues that we've got with our residential program at this point in time. So we'll be looking for working with the state and DOE on trying to get that set up. Key is in the financing, obviously, as I'm sure everybody's figured out, the easier that it is for the homeowner and the property owner to take advantage of that financing, the more likely you are to get their participation, both in terms of upfront costs and the length of time that they have to pay the funds back. That in a very quick synopsis is where we're at with our program right now. Looking forward to working with folks like City of Baltimore who are obviously a little bit further along, and we can learn a lot from you guys and appreciate what we've already heard today. So look forward to any questions you might have, and thanks very much.
Thank you, Dan, and thanks to all of our speakers. This is Satya from COWS and the Efficiency Cities Network, and just want to remind folks you can ask questions in two ways, and we'll stay on for about, I think, 15, 20 minutes more to try and get to as many questions as possible. So if you have a question, you can raise your hand electronically by pressing 5* on your phone keypad. Or you can email it to questions@greenforall.org. And we've had a number of questions already emailed in. So, LaDon, why don't we take an email question first?
Sure, that sounds good. Soledad Boyd from Community Labor United in Boston asks, she says, here in Boston, when code enforcement becomes involved, it's usually a result of tension between the tenant and the landlord. How will you temper that situation to get the landlord to allow weatherization work done in a unit?
LaDon, could you just repeat that one more time?
Sure. The question was that in some cities like Boston, when code enforcement is involved, it's usually because of a tension between the tenant and the landlord. How do you temper that situation to get the landlord to allow weatherization work done in a unit?
I'll take the first crack at this, and then Dan and Alice, please, where you think. But I know we have two things on. Number one, a lot of the work that we're bringing to the owner is going to improve their long-term maintenance cost. Secondly, we are reducing, because we're addressing health and safety issues, we're actually reducing liability issues for them. And so even if this is where health and safety actually help build the argument and bolster the engagement in green often. Because if you have, for example, a rental property owner, if they are not responsible for the monthly bills, right, on weatherization, they possibly may not care, right, and don't feel that the investment or the hassle is worth it. But if we can also show them that by repairing the water intrusion issues, by reducing the pest management issues, reducing the lead hazards, the trips, falls hazards, we reduce their liability. So that's one. Number two, the value and stabilization issues of housing are bearing out for us. So that is a second piece of it. We clearly try to compel owners to do the things they should do because it's the right thing, because it's effective. But I think the reduction of liability and the reduction of possibly facing code enforcement in the future becomes big incentives to get some of our more on-the-fence or recalcitrant owners to play in this. On the homeowner side, clearly it's really compelling to be able to change the quality of life, to see their kids be able to sleep through the night, to not go to the emergency room, to be able to get to work, as I said, and the comfort issues of being able not only to stay warm and dry and have a well-ventilated house, but the results of wealth increasing rather than wealth depletion for both the health costs and the energy costs are clearly compelling for owners. And as we move that frame out to more of the community network, there is great value, and I think Alice pointed to this in our Lake Avenue, but we see this throughout the city and in our other sites. There's just tremendous value when someone sees the end product of this that they want in too, and we really begin to get a lot of traction there. But I will tell you that more and more we're seeing property owner organizations who want to be seen as green landlords, and where we couldn't get them on the reverse to want to do work on lead poisoning prevention because it was a very paralyzing issue, the green becomes a bridge to sort of that feel-good that we're able to accomplish health and safety utilizing the green as the entree. And so it's kind of worked both ways for us.
Great. Thank you so much. Dan or Alice, did either of you want to respond to that one, or should we move?
No, I would just add that BNEC our program is open to both homeowners and renters, and we knew that when dealing with rental occupants that we would have we looked at it as an opportunity to educate the landlord and the property owner in terms of what they could do, and so it added another level of education and outreach that we did for our program.
Great, thank you.
And just a reminder that it's 5-star on your keypad if you want to ask your question yourself, and otherwise we'll go to another email question.
Great. So the next question from Ellen Ton. This is a quick one in Wayland, Maryland, Massachusetts. Sorry. Is the integrated assessment form available online or available for local programs to use? So Ruth Ann, are you all making that integrated form available beyond the 14 pilot sites?
We are.
Great.
And it will be posted if it hasn't been posted, because our communication site for GHHI is the official launch with the federal government was actually July 15th, even though we've been doing a lot of the groundwork prior to that. So it will be available, but what I will tell everybody who has it, there's going to be two things that are tools that I think are helpful. One is a menu of interventions that we will look for as one of the practices for a Green and Healthy Homes Initiative site. But the comprehensive assessment form will be in continual kind of improvement, but there will be a template, certainly that will be in an open format. And starting in September, along with the National Association of Public Administration, we're going to be doing a Web 2.0, a national dialogue, or what is sometimes known as a national jam, on issues of green and healthy housing. And so there'll be a larger national communication on the use of the comprehensive assessment tool and barriers and recommendations. And so we will get out to your collective network the information to participate in that as well.
Great. And I'm sure you're going to get a lot more cities knocking on your door asking to be one of the GHHI pilot sites. So,
well, yeah, because I think with the thing that makes this attractive is obviously not only kind of being part of the, as I like to call it, the cool crowd, but there's lots of cool crowds out there. It is going to, we think, better position cities and nonprofits for funding, in terms of eventually kind of becoming that designation where foundations and federal governments will know certain practices are in place. And so that's what we hope, certainly.
Great, thank you. This is a question for any of our speakers. We have a few questions from Sammy Chu at Long Island Green Homes. I'm going to start with one, just asking, will GHHI recommend certain materials for weatherization and energy efficiency work? Is off-gassing being considered when choosing materials for that part of the scope?
I hate to keep being the only one answering, but yes, we are looking at material types, everything from the caulking to the paint to the flooring. There's also a great resource on that currently, and some of the green communities work with our partner at Enterprise and others. But we will clearly be looking at that as we're looking at a uniform standard as our primary goal. But we have to put in place the tools, and I saw somewhere on Dan's slide, the easy button kind of thing, and we want to create as much easy buttons as we can to get people kind of putting these practices in place. And affordability in use is also going to be a key factor.
Great, thank you. Dan, are you all looking at materials as well in your implementation of the retrofit or the Better Buildings grant?
We will be, yeah. And I guess one of my thoughts is, and I'm sure there's some of this going on, but it sounds like we have multiple entities and agencies working on some of these issues. I know the Department of Energy has teams working on standard specifications on the energy side. So any cross-fertilization, I think, that can occur in terms of, when you start talking about building material specifications or work specifications, we need to be looking for those opportunities to share information. So,
right. I'm sorry, Dan. The Federal Interagency Work Group on Healthy Housing, Healthy Homes, which is made up of DOE, HUD, and a number of other agencies, will also be creating a website out of all of that will help to bring all of this work together called healthyhomes.org. And it's soon, or whatever dot it's going to be. But that's in the works also as another kind of clearinghouse for this type of information, and that should be coming within the next year.
Great.
Just to remind folks, if you want to ask a question live, you can press 5* on your phone keypad, and appropriately we have somebody who just did that. I think it's somebody from Charlton, Massachusetts. Go ahead.
Yes, hi. My name's Peter. I'm calling on behalf of the Worcester Energy Barn Raisers. And I just had a question on how far some of the weatherization programs go, if insulation is brought into the picture, or if it's light-duty weatherization.
For us, it's the full weatherization standard, including insulation, and so that I can say for our program.
I know in North Carolina, it does include insulation as well as weather stripping, those being the primary products.
Is there any diagnostic tools you use? In the first session, I believe there was some training involved with it as part of the program, and I'm just wondering if anybody's using infrared cameras or any other tools where they're trying to add a significant training component to it with maybe some newer technology.
I'm not a weatherization expert, but I know our system in North Carolina works through regional service providers. I know they are using the full complement of blower door, duct blasters, infrared cameras in their pre- and post-assessment work for the weatherization program here in North Carolina. So I'm pretty sure that's part of their program.
Great. Thanks for your question. We have another question from somebody at the New York Energy Star Homes program. Go ahead. Hi, somebody from New York calling in with a question?
Yes, hi. Sorry, I was on mute. This is Art Olson with Conservation Services Group. I was wondering where the information on all the cases of childhood lead poisoning, asthma, and carbon monoxide poisonings, where that information came from.
We can source that. We told LaDon we're going to repost the slides up, and we certainly can give you the source, but there's a whole we'll put a slide in of all the source data.
Perfect. Thank you very much.
Okay. And we can also help you localize, do the source on localization of data if you need it for your region and jurisdiction.
Super. Thank you.
All right, thanks for your question. We have another question. We'll take a couple more live questions and then do maybe an email question. We have a question from the Los Angeles area. Go ahead. You're unmuted. Somebody in Los
Hello?
Angeles? Hi. Go ahead.
I was just calling to see if the typical procedures for recording and posting recordings of this call are going to be online eventually. I'm just having difficulty because my signal, I just want to know when I'm sorry.
That's okay. It's a good question and gives me a chance to tell folks what we will do. This call is being recorded, and it will be up on the website, efficiencycities.org. Give us a couple of days to get it edited and posted, but then you'll be able to listen to it and see the slides at the same time right on our website, and that's efficiencycities.org. Let's go for one more live question, and then we'll go to email because we have a number of email questions as well. Somebody also in the Worcester, Mass area?
Is that me?
Yes.
Oh, hi. I just sent an email in, too. I wasn't sure if I knew what I was doing. I'm just I'm from the city of New Bedford, Massachusetts, Old Bedford Village Development Corporation. How do we apply to be part of this Healthy Homes Initiative? We are a brownfields community, and we have done things in the past with healthy initiatives and all that stuff, healthy homes, healthy communities. And to combine all of this stuff to the interagency government agencies is very, very important for our position anyhow. And so I'm very much in happy about this project. But how do we get really involved with it? How is there an application we got to submit? Is there registration form? Are we going to do? How do we actually be part of this?
Okay.
It's a great question. We had several people email that question as well.
Okay,
So
and
thank
that's
you
great.
For asking
And let me tell you the very first thing is if your city or your entity is interested in becoming a designated Green and Healthy Homes Initiative site, please email me at ranorton@leadsafe.org. Let me tell you that before the end of this summer, we will have posted criteria before the end of August. Not summer's in middle of September, right? But by the end of August, we'll have posted criteria on how future sites will be selected. But we will also make sure that we include you in the learning network. And so we will ask you, make sure you get us the information, and we will get back to you. Our first priority is to get our 14 sites running smoothly and up and running, but we are already cognizant of some very large city partners and some small cities, which are really important that we look at this in a diverse manner, that are already starting to position themselves to become a GHHI site. So we would love to hear from you.
And can you tell people also how they would connect with the lead agencies in the pilot cities? What's the best way? We've got a couple of those questions as well.
I will certainly get that response back to you in writing, but Mike Shaw, who's on our staff and I think is on the call, is our lead staff person for communications on this effort, and will make sure that he connects people to the public-facing site for communications, and if people have a particular city that they're looking to connect with, we will make sure they get connected as well, and his email is mshaw@leadsafe.org.
Great. And then I think we'll probably have time for maybe one or two questions, so if there's anybody else on the line that has a question, you could press 5* on your keypad. Otherwise, LaDon, let's take another email question.
Sure. We've got a couple of questions related to training. Luis Barrera from the National Council of La Raza in Los Angeles asks, when you create a new site, do you also train the weatherization and energy auditors, or is that something that other partners, for example, the CBOs, provide? Also, Stephen Christensen from the WARM Training Center in Detroit says, our organization is training weatherization workers in Detroit. Are there any specific skills we should be training our students on to prepare them to support the Green and Healthy Homes Initiative? Are there resources we should be using to align our program with the GHHI goals?
First of all, to the person in Detroit, there is a Green and Healthy Homes Initiative site that is underway in Detroit, and if you email me, I will get you connected to that key piece. And we are working with HUD on the national training of how the integrated and DOE on the integrated training practice. Currently, we are taking people who have been augmenting their training, but over the next 2 years, what we look to develop here is a national training standard that incorporates energy and health. Our partners at DOE, Julie Hughes at DOE, has been most generous in helping to move this initiative from their standpoint forward, and so through the Healthy Homes Work Group and the Green and Healthy Homes Initiative, we are working right now to have the integrated practice of training and workforce development training, and we have just brought a staff person by the name of Bert Cooper, who will be joining us on to work specifically on this issue of the integrated training practice. So we're happy to have direct conversations on this, and we will also post this on our NAIN communication site as we progress on that. And we're very hopeful that entities like Green for All will be a national partner in making sure that this practice gets done correctly.
Great, thank you. I think we have time for one more question, but I want to say before we take that question that if you did email in your question, we can forward those on to the speakers. And also, you'll notice at the bottom of the PDF presentation, there is contact information if you want to get in touch with people directly. But meanwhile, we have somebody from Push Buffalo in New York. Go ahead.
Hi.
Hi.
Hi, this is Sam Bordia. I'm from Push Buffalo. And basically, the question that I'm asking is, for the GHHI program, how are the retrofits funded? Was it mostly through loan-type programs, or would it be paid back, or was it all grants?
I'm sorry, I didn't hear that.
Sorry. So for the GHHI retrofit programs,
yes, sir.
How are those funded? Was it through loans that would eventually be paid back over a long period of time?
No. Each of the sites, what we are doing, because some of the sites are running, some of the sites are not in full production or yet, but some of the sites that have come on later are just getting convened and started. So I want to be very clear about that. But in Baltimore, it has been obviously grants from Office of Healthy Homes, Lead Hazard Control, Healthy Homes Demonstration Program funds, which their new NOFAs are coming out at the end of this month. And people should pay attention to that. That's about $130 million of funds. The Department of Energy Efficiency and Weatherization funding, state energy funds, community service block grant, community development block grant, funding, and a number of other streams of funding, for example, in Baltimore, but also augmented by philanthropic funding from national and local foundations. And so in each of these sites there are, number one is putting in the standards, practices, and principles to remanage and repurpose and redirect funds to work together to better leverage, because as we have seen in the initial work, where we have done just that, we've been able to improve use of funds by 25%, which means for every fourth house we do, the fifth one is free effectively. What used to cost us the same amount of money to do 5 or 4 houses, we now can do 5. That then is better positioning because of the change in the Notice of Funds Availability and the federal priorities toward green and healthy. It is positioning entities to be more competitive and to receive additional points and preferences for funding through various agencies, and it is providing that vetting of green and healthy for foundations to look at over time, that they will know that entities are working in a green and healthy homes standard.
Okay, thank you.
Great. Thanks for your question. It was a good one. All right, I think we have to wrap up now. So I want to say a big thank you to all of our speakers and also to LaDon from Green for All for co-hosting.
Thank you.
Want to really encourage people to sign up either for the Efficiency Cities Network at efficiencycities.org or for the Green for All Retrofit America's Cities Community of Practice at greenforall.org. Anything else, LaDon?
Yeah, I just wanted to thank you, all the speakers again, and just say that as the mother of a child with asthma who has been hospitalized multiple times, I'm just really compelled by this approach, and I think that an integrated approach is really an important way and perhaps a very key way to reach people and have comprehensive retrofits at all income levels. So again, I want to also thank Satya and James at ECN, and I look forward to continuing the discussions offline.
And we will be back again with another Efficiency Cities Network call 2 weeks from today, which puts us into August. That's August 3rd, and we will hopefully talk to many of you then. In the meantime, please stay tuned at efficiencycities.org for that topic.
We'll have updates on the PACE process very soon. There's legislation moving at the congressional level.
All right. Thanks, everyone. Have a good afternoon.